Now I'd like to introduce Ken Scott. Ken is the Director of Adult Mental Health in the Mental Health, Children's Services and Addictions Branch, Department of Health and Wellness. Ken joined the branch in September 2010 as the Coordinator of Special Projects, having been seconded from the CDHA Mental Health Program for a year. In November 2010, he assumed the role of Acting Director, Adult Mental Health. We actually kept him, which is a good thing. Ken brings a wealth of experience gained through 25 years in the mental health field. He began as a staff nurse in the Nova Scotia Hospital Acute Care and Forensic Services units. He was then acting nurse unit manager for Forensic Services, team leader of the Nova Scotia Hospital Rehab Services in the Forensic Services, Health Services Manager with Capital Health, East Coast Forensic Hospital, and most recently Program Manager with Capital Health Mental Health Program Inpatient Services. Ken will be talking about the guideline development work that will come out of the Domestic Violence Action Plan and out of the work that we did here today. Ken?
Good afternoon, and thank you for the invitation to be able to speak here today and offer actually some closing remarks on behalf of the Department of Health and Wellness and the Mental Health, Children's Services and Addictions Branch. It's been a long but fruitful day of listening, speaking, debating, learning, and sharing. This year, the Health Equity Forum has aligned with DHW's policy, priorities, and deliverables within government's Domestic Violence Action Plan. It is a priority of government to integrate cultural competence and health equity into our actions and policy recommendations. Our commitment to diversity will be reflected in all policy development and recommendations. Our commitment, including the soon-to-be-released Mental Health and Addiction Strategy. This forum has provided a venue in which diverse perspectives can be shared and respected. We will use this information to inform health system policy that integrates health equity, culturally specific approaches to DHW's response to government's Domestic Violence Action Plan. The action plan recognizes that domestic violence is a complex issue, requiring cross-government and multi-partner approaches to the development of a continuum of service with multiple prevention, intervention, and enforcement activities. The action plan recognizes that these initiatives must lead to sustained change. Government is actively implementing the Domestic Violence Action Plan for the province of Nova Scotia. The implementation work is co-led by the Department of Justice and the Nova Scotia Advisory Council on the Status of Women, and includes other government partners such as the Department of Health and Wellness, Community Services, Department of Education, and Services in Nova Scotia, just to name a few. Department of Health and Wellness has identified as the lead department in many activities, and progress is underway in some of these activities. These include promoting the 811 and provincial helpline systems, development and dissemination of provincial policies and guidelines to direct care providers, development of multi-departmental training partnerships to address a variety of training needs identified across sectors, to develop and test culturally competent and relevant training materials through training partnerships, distribute educational resources and healthcare systems to assist screening and referrals, and to work with the University of Dalhousie to incorporate education and training on domestic violence into their curriculum for medical students as well as other healthcare providers. Currently, Heather Dawson, a senior coordinator with the Mental Health, Children's Services and Addiction Branch, is taking the lead on working with, on taking this work forward for the department and the branch. Heather represents the DHW on Multi-Departmental Domestic Violence Implementation Committee. She's also been working hard on this project as a member of this year's Health Equity Forum Planning Committee to bring all of you together to inform this day and to inform DHW initiatives under the action plan. So I want to say thank you to Heather, who's here and was one of the facilitators today. On behalf of DHW, I want to extend my sincere thanks to the Diversity Committee of Nova Scotia Department of Health and Wellness and to Sharon Davis Murdoch for sponsoring and hosting this second annual Health Equity Forum, this year focusing on domestic violence. This event has provided a unique opportunity for engagement of a variety of diverse stakeholders, service providers, academics, educators, government and community voices, and those with lived experience. And we can never forget the people with lived experience. The information and diverse perspective gathered from this day will be invaluable as the Department of Health and Wellness as we move forward with the implementation of our Domestic Violence Action Plan. I also want to acknowledge the members of the Health Equity Forum Planning Committee for lending their expertise, their creativity, their hard work, and perseverance to make this forum a reality. I'm sure you'll agree with me that with your help, they've produced a unique opportunity for learning, networking, and capacity building for stakeholders across the province. More importantly, while the forum itself ends today, the contributions made will carry forward. Perhaps most importantly, I want to take this opportunity to extend all my thanks to all of you, to the presenters, the organizers, speakers, panelists, facilitators, and participants. Thank you for lending your time, your dedication, your expertise, and your voice to today's proceedings as we struggle to overcome domestic violence. Your input into today's proceedings will inform our efforts as we move forward with the action plan to develop culturally competent domestic violence guidelines, policy, training for health professionals and students of health professions. By enhancing and transforming the relationship between health service providers and their patients and clients, we make a real progress towards providing the best care for those affected by domestic violence. Respecting, acknowledging, and learning from diverse perspectives. We at DHW are honored by your participation today and grateful for the opportunity to work in partnership with you towards a common goal so that all persons in Nova Scotia may live free of domestic violence and abuse. Your voices and theirs have been heard today. Thank you very much.